The thermal guns or temperature guns are pointed at persons to determine whether they have a fever without touching them. They have been introduced in several airports across the world as the novel coronavirus continues to spread. Resident representative for a Pan-American Health Organization, World Health Organization in Guyana, Dr. William Adu-Krow, during an interview with the newsroom explained how the tests are done at the ports of entry.
If you have fever, then we pull you aside, and we have an instrument that we use to measure your risk. When I say an instrument, it's a questionnaire. It's a questionnaire instrument that we use to measure one's risk. And once that person is deemed at high risk, then we determine whether the person needs to have self-quarantine or needs isolation.
Guyana's first case of the coronavirus disease 2019, COVID-19, was confirmed on Wednesday after a 52-year-old woman who had diabetes and hypertension died at the Georgetown Public Hospital. The woman of Good Hope on the east coast of Demerara recently traveled from New York, United States of America, which has several confirmed cases. Samples were taken from the woman and tested at the National Public Health Reference Laboratory and confirmed Guyana's first case of the virus. Dr. Adu-Krow said much care was taken with this process.
Once they take a sample, they take it to a room with a big machine that actually extracts the DNA or the RNA. In this case, it's an RNA.
What's an RNA?
RNA is a type of cell that will have the virus.
Where do they take this? What sort of sample do they take?
From the throat.
Okay.
Yes, nasopharyngeal sample. So you put it in that machine that extracts the cell, and then we use amplification. There's a machine that will amplify everything that is in the cell, so that is huge for the PCR to then pick. And the test came out conclusively as positive. So we have a positive case.
The confirmation of the test results was announced by President David Granger, who also noted that precautionary measures are in place to quarantine anyone who came into contact with the woman.
Measures are being taken to prevent the risk of community spread. These measures include dispatch of a health team to the home of the deceased for assessment and initiation of public health prevention measures, identification and contact tracing for all possible exposed persons, meeting of ministry officials with members of staff at the hospital, and implementation of necessary interventions.
The president sought to discourage public gatherings and non-essential travels, even as the Ministry of Public Health implement measures to stop the spread of the infectious disease. The World Health Organization has stated that the novel coronavirus is the first global epidemic which can be controlled, and Dr. Adu-Krow shared some tips on washing your hands properly.
You have to make sure that you wash both palms, and then the back of the palms of each one, and then the interlocking, and then each finger you take them individually. Make sure that once you rinse, you don't touch anything. You take the paper towel and clean it off, and make sure that you use the same paper towel to open the door to get out, because you've cleaned yourself up and then you go and touch an infected door again. I think that doesn't work.
Bibi Katoon reporting for the newsroom.